Health Matters with Karen Key.
Well, in South Africa, 89,000, would you believe, new TBI or traumatic brain injury cases are treated every year. Now, TBI is the most common cause of death and disability in young people. And to tell us more about this, I'm joined now by Dilys Jones. She's worked in private practice for over 20 years as a speech therapist specializing in adult neurological disorders. Dilys, good evening. Welcome to the show.
Good evening.
I think, first of all, let's just explain fully what exactly TBI or traumatic brain injury is.
Yes, a traumatic brain injury is essentially an injury to the brain resulting from any kind of accident or fall or direct trauma to the brain. In other words, when we refer to a traumatic brain injury, we're not usually talking about the kind of injury that a person would get from a stroke or from an infection. So the most common causes in South Africa would unfortunately be from motor vehicle accident or acquired in interpersonal violence.
Now, what actually happens when you have a TBI? What actually happens to you? I mean, your brain obviously has been injured. How does that affect the person?
Well, there are as many different kinds of outcomes as there are types of brain injury. So if we think of motor vehicle accident, which unfortunately is such a very, very common cause of TBI in this country, what commonly happens is that if you imagine the moment of impact in a motor vehicle accident, the person's body rushes forward, often hits the front of the vehicle with tremendous impact. So the brain moves very fast forward and then actually slides back almost. And what you have there, if you think of the brain, has all these masses of little bony structures sticking up, that you have a very dramatic shearing of tiny, tiny little tissues inside the brain, which causes tiny areas which may not even be visible all over the brain. So that most commonly after a brain injury sustained in a motor vehicle accident, you get a very diffuse kind of injury, which means really that you can have a multitude of different kinds of problems. So sometimes you may have a specific kind of speech or language problem that most people, when they hear of speech or language disorder, would imagine that is the person has physical difficulty in speaking or has difficulty thinking of the right words and putting them together in a sentence. But often when you've had a brain injury, particularly involving the front part of the brain, the frontal lobes, the problem may not be an obvious difficulty with producing the sounds of speech or thinking of the right words. The problem might actually only be apparent in a level of conversation. So the real classic feature of communication in a person who's had a brain injury is tremendous social difficulty with language.
Is something like a TBI possibly misdiagnosed or not diagnosed at all? Can people have an injury like that and still function normally initially after the accident or whatever the thing that was that happened to them, and possibly a week or so later then it only becomes evident that there was a problem?
Yes. When people have had a very severe traumatic brain injury, there is usually associated period of unconsciousness. So obviously a person then would be aware that there had been a brain injury. One of the things that can also happen, though, is that a traumatic brain injury can be relatively mild, in which case it may be missed. So sometimes this happens when there's been another injury. So, for example, a spinal cord injury. So all the focus is on the spinal cord injury, and it may actually be missed that there has been a mild brain injury as well. And then, or also concussive type injuries acquired on the sports field, for example. A person knows they've had a bash on the head, but feels, that they've come round and are feeling pretty much okay. And under those conditions, they may well only become aware a little later on that they have problems. Those kinds of problems tend to be very subtle, so it isn't the sort of problem where someone's going to turn around and say, gosh, I noticed that you're not speaking properly. But often those patients might become aware that they just not as sharp as they feel they should be. So they occasionally can't think of the right word when they're trying to say something, or they lose the track of what they're trying to say in a conversation.
How important is it for that immediacy of diagnosis? Because I've been very impressed watching the rugby lately that when someone has been bashed on the head, they take them off and they now have this concussion sort of service, or whatever you like, on the sidelines, and they check them out before they can continue playing, which I think is amazing. Because how important is that immediate diagnosis?
Yes, I think that that's terribly important. Obviously a medical doctor would be able to give you a better answer to that in terms of preventing more injury, which is also important. So sometimes a person might think they've only had a mild concussion and is fit to carry on playing, but their own judgment is not so great, in which case they're vulnerable to another injury. Even if that's not the case, it's very, very important to have accurate diagnosis so that you can have appropriate treatment. Too many people who have milder injuries are left to struggle on their own, don't realize necessarily that something has happened, and are kind of baffled and wondering why they're just not coping as well as they should be. You see this quite often in younger children or in adolescents, for example, who start having difficulties at school and really don't understand why. And those kind of problems are often attributed to other things in teenage children. So they're accused of drug using or not cooperating at school, when in fact there's a reason and a cause which can be treated.
Now, I mentioned earlier, worked for over 20 years as a speech therapist. You specialize in adult neurological disorders. So people that have had a TBI, normally then once the problem has been diagnosed and they are now having communication issues, that is when you see them. What kind of work do you do with patients with TBI, Dilys?
Well, they'll work with the average TBI patient that we see would start receiving some input from a speech therapist very, very early on whilst they're in hospital. So as soon as the person recovers consciousness and period of coma, the length of the period of coma generally, as a rough rule of thumb, suggests the extent, the severity of the brain injury. So the longer the period of unconsciousness, the more severe the brain injury. As I say, that's only a rule of thumb. It's not cast in stone. But generally, what would be desirable is for the speech therapist's input to begin as soon as the person regains consciousness. So a large number of people who have neurological injuries of any kind have swallowing difficulties. So in many cases, the very early focus won't even be on communication. The very early focus may well be on getting the person swallowing as safely as possible early on, or on alternatives to taking food by mouth if that's required. Then as soon as that's been sorted out, the very early focus would really be on developing some way for the person to communicate. So many brain-injured patients, when they first regain consciousness, may be unable to speak at all. They may have physical, muscular problems, neurological, muscular problems, which prevent them from physically speaking, in which case the approach of therapy would be to develop some kind of alternative system, which would usually be temporary. There are, unfortunately, some people who have such severe physical complications that they never actually regain the ability to speak, in which case alternative communication systems would be a permanent solution. But for most, that would be temporary. A very important focus in the early days of recovery was also on teaching the family, on educating them what to expect. It's a very frustrating time for a person who is just recovering consciousness and is learning to adapt to a whole new way of being. So that it's very important to involve the family, explain every step of the way, the journey that they're on. And I think it's really important to understand that recovering from a brain injury really is a journey. A lot of people think that the real milestone is achieved when the person regains consciousness. And in actual fact, and for many people, the journey is only beginning then.
But, it's not just, you talk about the communication skills, but I mean, a lot of people, some people I would imagine, are able to communicate. They can talk, but it's what happens with that communication. They're talking and you talking to them, but they're not quite understanding. And there's that whole processing thing that seems to also go a little bit awry.
Yes, and in fact, for many families particularly, that type of person is very difficult to cope with. So one can see and understand the person who cannot speak at all or who really has massive and obvious communication problems. But the person who has the more subtle social kind of communication problems is very difficult and very frustrating to interact with. So the hallmark of those people might very often be difficulty with memory. Now, when you're having a conversation, you might not think, well, I don't really need to remember very much to have a conversation, but in fact that's not the case. So in the very early days, and sometimes for a much longer period, the person who's had a traumatic brain injury has tremendous difficulties with things like remembering, paying attention, organizing, planning, sequencing, tying everything together. And if you imagine any old conversation, in order to have a conversation with someone, you actually need to be doing those things all of the time. So that many times families will comment or complain, he speaks, but he says the wrong things, or it's a bit embarrassing, he's a bit inappropriate. And that's not because the person is badly behaved or because they've had a personality change. It might actually be because many brain-injured people experience things like, if you can't remember what it is that you want to say, you have to quickly blurt it out while you can still remember the point that you were going to try to make. So that disrupts things like normal turn-taking. The person comes across as being rude, but in fact, they're really trying to say what's important while they still have it in their heads.
Now, is this something that somebody like you would actually be able to assist these patients with, and also to try and educate, if you like, the families of these people?
Yes, very much so. And these kinds of problems, which have a huge, huge impact on a person, in fact, less so whilst they're still overtly ill and in hospital. But you can imagine the kind of results from a person who battles to use communication socially outside of hospital, perhaps trying to reintegrate into the workplace or into school. So they have tremendous, tremendous negative implications for the person, and they really can be helped. So often in the very early stages, our focus would be really just on helping the person to organize their thoughts, to remember, to plan, and not necessarily taking those skills so much into conversation. But particularly once the person is out of that very acute stage, they can really be helped. Family members often need to be trained as well in how to assist the person in a conversation. So perhaps the person with a brain injury isn't able to monitor the way they're speaking themselves, isn't able to actually make the changes unless somebody else offers some kind of subtle little hint or cue to remind them what they need to be thinking about and focusing on. So that family members, again, play a very important role on being that kind of external aid or cue to help the person do the right things.
Do these things, can you recover from a TBI?
Yes. I think that in terms of the medical injury sustained by a TBI, the brain injury itself is permanent, but certainly almost every person who has had a TBI has the ability to improve from their initial status. In other words, they may never return to completely the way they were before the injury, but certainly there is ability to change and progress. And one of the great things about having worked with a number of patients over a long time is that I believe more and more every day that virtually everyone actually improves. And they probably continue to improve long after the sort of conventionally expected time frame.
And I think it's very important, we keep mentioning the families, but I think because the person with the injury and who's having these problems, I'm sure that if they're stressed because of the problems, I'm sure they realize at some point that they're having these problems, that could actually contribute to making the whole situation worse.
Yes, of course. And I think that I often feel that in the early stage after a brain injury is a sort of a honeymoon period, because the person himself often doesn't realize, doesn't have full insight into the extent of his difficulties and his losses. But the longer time goes on and the more the person is integrated into their normal daily life, the more those kinds of difficulties become apparent and the greater the sense of loss that the person experiences. And I think, make no mistake, that I say silent in the sense that they're not, it's not a very good analogy, not really visible difficulties, particularly those which are social, have a devastating effect on a person.
Well, Dilys, I hope we've actually explained exactly what this is, and the most important thing, of course, is letting people know that there is help out there. There is something that can be done to help somebody possibly in your family that has unfortunately suffered from a TBI. But Dilys, thank you so much for your time, and thank you very much indeed for joining me on the show this evening.
That's an absolute pleasure. Thank you.
Dilys Jones is a speech therapist in private practice, specializing in adult neurological disorders. And for more information, you can contact the South African Speech Language Hearing Association on 0861 113 297, 0861 113 297, or take a look at their website. It's www.saslha.co.za.